been doing testosterone replacement therapy for, I'd say, the last 3 weeks, maybe a month.
I think it's been enough.
Yeah, it's been about a month. I really like it. I need to be on it. You know, medically speaking, I require testosterone to be, my body runs a little bit more efficiently. You know, so first step of the process, and I'm just going to run through the process from the consumer, from the patient end of it, and then I'll let Dr. Jenn explain the physician end of it. So I was a little bit tired, a little bit almost lethargic. My libido wasn't horrible, but it wasn't great for my age. My focus wasn't fantastic. I just didn't feel like I was operating at the most that I could. You know, I didn't feel like I was at the most efficient level. I was just a little bit underneath. You know, I felt like I was operating at like 80% of my potential.
That was on a good day.
Yeah, on a good day. I had this layer of fat around my stomach. Not a lot, and I work out. You know, I exercise very regularly, but I had this layer of thin subcutaneous fat, and no matter how much I was able to, you know, rip the shoulders and the back and the arms where I didn't carry that fat, I could not take it off of my chest and my stomach. It would not come off. It was so stubborn. And my body fat index had almost like it had like a floor. Like I could only go to this level, and then no amount of dieting or anaerobic exercise was changing it. So so Dr. Jenn gave me a requisition. She sent me to a diagnostic center. I got my blood work done. If you have insurance, this is going to be $10, $50, $100. It's not much. And then, so about a week later, she had, I guess, done all the math. She came up with a program for me, and it was exponential. So I started on a small amount, and I built up to the amount that I'm on now, which still is not that much compared to, I'm not a bodybuilder. I have no interest in being a bodybuilder. I'm not, you know, I just wanted to be the best version of myself naturally that I could be. So I was about a 900, which that's in normal range, but normal range is 18 to 80 years old, you know, 200 to 1500. So 900 is about a 60-year-old, and I'm 25. I don't want the testosterone of a 60-year-old. I'm not ready for that. I'll deal with that when I'm 60. I want the testosterone of a 25-year-old, and that's up there closer to 1400. So, you know, we slowly made our way to those numbers. I haven't experienced any moodiness. The schedule that we have is a custom tailored schedule that we came up with. I'm not going to tell you guys what it is, but I'll tell you that I don't do it once a week, just because it's our patented program. It's, you know, we're not trying to give this information away for free, but so I don't do it once a week. You know, I don't have peaks and valleys. I'm happy pretty much every day. You know, I'm not stressed out. My libido is awesome. You know, I was able I dropped that stubborn fat. You know, I haven't seen any of the downsides that some of my buddies have talked about when they're doing 500 shots that they got online.
Right.
Also, they're paying a couple $100 for one vial. I pay $25 for 5 ml, and I get it from a pharmacy down the street. I know it's totally safe. And then also, most important, human chorionic gonadotropin, or HCG, super important. This stuff right here is what's going to keep my body from quitting its natural production of testosterone, which then would result in atrophied testicles and quite possibly permanent atrophy of the testes, meaning that my body would stop producing its own testosterone permanently. There is no bounce back. Like, I could get off testosterone, I'm not going to bounce back. That's a theory that is passed around. That's not a true medical fact. Your body, once your testicles reach a point on the bell curve of atrophy, that's it. So if you're taking exogenous testosterone like I am, you need to be on HCG. and this is what's going to save you. It's going to save your natural production. It's going to save your testes if you ever want to get off of this. And then I'm also on an aromatase inhibitor called an anastrozole. And just a tiny little bit. It's pretty much kind of a standard dose. The way I understand it, it's not a custom dose or anything. And that just keeps my estradiol from eating my testosterone. So our body's natural way that it works is in an inefficient endocrine system like the one I had, my estrogen was essentially stealing my testosterone when it would come out of my testicles. If that makes sense, and it would store to my fat, which would create more estradiol, more estrogen, and then that cycle continues. So the aromatase inhibitor, that's how you fix that problem. So if you're on steroids or testosterone and your testicles are shrinking, they don't need to. You need to be on an aromatase inhibitor and HCG. So that's my experience. I'm really happy. I have no complaints right now, and I know that I'm not permanently hurting my body, which makes me feel a hell of a lot better about doing this whole thing. Worst part about the whole thing is, a couple of shots in the rear, a couple times a week. So, I mean, as far as it goes, that's not crazy downside to the benefits that I'm getting. So I'll let Dr. Jenn wrap that up real quick.
Yeah, I kind of went into the whole process here.
You're just here for the science.
Yeah, just for the science. No, our typical person comes to us, and we have different types of typical, but we get a lot of questions from bodybuilders and people who've been on cycles and stuff, and they have, X, Y, or Z issue, and they are like, just how do I fix my issue? Number one is be completely honest. The most important thing is be completely honest. I'm not the police. I don't judge. I really could care less. I just have to have the information to make an informed decision about your treatment. Second is, without labs, I can't tell you anything, because it may look like you have increased estrogen, or your diet just might really suck.
Yeah.
So I have to know exactly what's going on.
Eating a bunch of soy.
Could be, phytoestrogen.
Phytoestrogen, yeah.
So, those are the two most important things to understand going into it. History is very important. Not police, don't care. Just be honest. And two is the labs. Once I get the labs back, again, like you said, the testosterone on the scale varies. It's not divided up by ages, which it should be, but it's not.
Right.
So I look at it and see how much you would need to perform at your maximum level for you. Obviously I treat a 70-year-old differently than I treat a 25-year-old.
Right.
Do I treat them like they should have a 70-year-old's testosterone? Well, if they're going to feel better with a 40-year-old's testosterone, why not do that? It's not going to hurt them. Things that would rule it out for some people are like prostate cancer, breast cancer, anything like that, where we're messing with hormones could actually increase, chances for them. So we test for things like that along with the blood work.
Right.
HCG, again, is very important when doing any kind of exogenous testosterone, because we don't want to ruin your own production of testosterone. I don't care about the testicles shrinking, and a lot of guys are like, I don't care, it doesn't matter to me, they can shrink up, who cares?
Right.
Well, aesthetically, I'm not really concerned if you care or not.
Right.
What I'm concerned about is how you make your own testosterone, because it's important to keep your own system up so you don't ruin your production forever. So that's what HCG is for. And again, if you're on a cycle and you're doing it, there's a proper way of getting off your cycle. If you just stop cold turkey, there is no give your body time to bounce back. That doesn't happen. You can just completely cut off your testosterone like that. So there's appropriate steps to wean yourself off.
Right.
Very important, because I've seen a lot of people talk about, you need to just cold turkey it to give your body a chance to rebound. That's not a real thing. It sounds great in theory, but in medicine, that's not how it works. So
Right.
There's a lot of feedback systems in the hormonal system that, you have to consider, and you just, if you don't know about those systems, you don't know to look for it. So aromatase inhibitor is super important. Like you were saying, aromatase is a enzyme that converts testosterone to estrogen. The more fat you have, the more aromatase you have. So the more aromatase you have, the more estrogen you have, and it's just this vicious cycle. So it's really important, to be on something to control your estrogen level, or else you're going to be even more frustrated.
Yeah.
You have increased testosterone and increased estrogen, which is, you know, not a good fit. So, anyway, that's a very quick rundown on our TRT system. And, you know, if you're with us, we have a very specific system, so we don't have valleys and peaks. There's no, you know, wake up upset one day and you're okay 2 days later. And, you know,
which
there's constant monitoring.
Which essentially is endocrinology. It's your hormones version of withdrawal.
Right. And then
once a week system is you're hormonally withdrawn.
Yeah.
In essence.
And for our personal system, you know, we rely on your feedback. We don't know how you're going to respond. So if you're like, man, I'm really, really agitated a lot, you got to give us that. We got to know that so we can, you know, tailor things around it, because everything's tailor-made for the person. You know, like with you, we started you off very minimally just to see how he's going to react to the testosterone.
Right.
You know, because you're not, you know, starting off.
Not everybody handles it well. Even
Right.
small amounts. Some people are not candidates for this. And that's something that's really important, is that we're not only talking to bodybuilders and people that have, you know,
It's very important.
we're talking, I mean, this is, you know, we're also talking to, you know, the 40-year-old guy that's seeing, 40-year-old guy. I've got buddies that are 20 with the testosterone of 80-year-old men, you know.
Or less.
It's not their fault. They're not less men. They just, that's your hormones, you know. That's your, something happened, your body, you never developed the testosterone. It doesn't matter why. Let's fix it. Plain and simple, you know, we're gonna fix it. So
the other thing is,
this is a safe way to get you operating the way you should be operating.
and baby steps is the answer, because if you were born with low test and, you know, your entire brain is used to functioning with low testosterone, you suddenly pour testosterone on it, that's going to change your entire makeup of your brain. You know what I'm saying? Your thoughts, your processing, everything. And so, and some people get on it and they're like, I'm not comfortable here, because the only thing I know is low test, and that's where I'm comfortable.
Yeah.
So, you know, baby steps.
Baby steps. Alrighty, well, thanks for watching. Hopefully you guys found this informative. And if you have any questions, feel free to post them at the bottom or subscribe to our channel.